$9,739. That is how much extra you will pay over 20 years for Medicare Part B if you delay enrollment by just 2 years.
Choose between Medicare Advantage and Original Medicare plus a Medigap plan. You're not only choosing between types of plans, but you're also choosing between cost structure. With Original Medicare plus a Medigap plan, your costs are premium heavy.
Most people are eligible for premium-free Part A and therefore don't incur the late penalty. We don't see that one happen all that often. It's far more often that we see people get assessed a Part B late enrollment penalty.
It's 10% of the standard Part B premium for each 12-month period you could have signed up for Part B but didn't. For example, if you went 5 months without coverage, you wouldn't be penalized because it's less than a full 12-month period.
Nearly 780,000 Americans are paying a permanent penalty on their Medicare premiums right now. Not for a year, not for 5 years, for the rest of their lives. Another 2.5 million are paying a lifetime penalty on their prescription drug coverage. These are people who missed a deadline, misunderstood a rule, or got bad advice, and they will never stop paying for it. Today I'm walking through the 5 most expensive Medicare mistakes that cannot be undone, what each one costs in real dollars, and exactly how to avoid every single one. Let's get into it. Okay, so here's how this actually works. When you turn 65, you get a 7-month window called your Initial Enrollment Period. It starts 3 months before your birthday month, includes your birthday month, and runs 3 months after. That's your window to sign up for Medicare Part B. Miss it, and the penalty is 10% added to your premium for every full 12-month period you were eligible but didn't enroll, and that 10% stacks permanently. The standard Part B premium in 2026 is $202.90 a month. If you delay 2 years, that's a 20% penalty. Your premium jumps to $243.50 a month. One benefits analyst calculated that a 2-year delay costs approximately $9,739 over a 20-year retirement. A 3-year delay? Even worse.
But if you waited 15 months to get coverage, you'd have to pay a 10% late enrollment penalty for the full 12-month period you went without Part B coverage. Now, let's pretend your Part B premium is $200. 10% of $200 is $20. This $20 penalty would be added to your $200 Part B premium each month. So you'll pay $220 each month.
And here's where a real story brings this home. A woman named Marion Leonard from Eastern Pennsylvania filed for Social Security at 65, but skipped Medicare Part B because she simply couldn't afford the premiums. 4 years later, when she tried to enroll, she discovered a permanent 40% penalty on her Part B premium for life. Her words, it reported by Reuters, she's being penalized for having been too poor to afford Medicare. On Reddit, another user described their father paying more than $20,000 in accumulated penalties over the past decade. More than $80 a month is deducted from his Social Security check, significantly diminishing every cost of living adjustment he receives. Now, to be fair, if you're still working past 65 and have employer-sponsored coverage, you can delay Part B without penalty. That's a legitimate, protected delay. The penalty only applies when you were eligible, didn't have qualifying employer coverage, and didn't sign up. Stay with me here, because this next part is what trips everyone up. A lot of Americans assume that if they retire and elect COBRA coverage, they're protected. They are not. COBRA does not count as creditable employer coverage for Medicare purposes. When your employment ends, your 8-month special enrollment period for Part B starts ticking immediately, not when your COBRA expires. Miss that 8-month window, and you're subject to the same lifetime penalty. Kiplinger documented the case of a man named Craig who chose COBRA over Medicare after retirement. He had a medical procedure. His COBRA insurer, Cigna, initially covered it, then reversed the decision saying he should have been enrolled in Medicare. Craig paid the entire $20,000 bill out of pocket. The confusion is so widespread that a bipartisan bill, the Medicare Enrollment Protection Act, was introduced in Congress specifically to create a special enrollment period for people caught in this COBRA trap. That's how common this mistake is.
If they don't sign up for Medicare Part B, 6 months later they have surgery. The hospital bills COBRA COBRA checks the person's age and then denies the claim because Medicare should have been billed first.
Even if you don't take any medications right now, skipping Part D when you're first eligible creates a penalty that follows you forever. The math: 1% of the national base premium, $38.99 in 2026, multiplied by the number of months you went without creditable drug coverage. Skip Part D for 5 years? That's a 60% penalty, roughly $23 extra per month permanently. AARP's research found that approximately 2.5 million Americans, 5% of all Part D enrollees, were paying this penalty in 2022. One Reddit user vented about paying a lifetime Part D penalty despite not taking any medications a decade ago when they first became eligible. Their conclusion: there's no real way to contest it. And look, nobody thinks they'll need expensive prescriptions at 65, but Medicare covers nearly 70 million Americans. And the odds of needing medication rise every year you age. The penalty is the government's way of keeping everyone in the risk pool. That doesn't make it feel fair, but it does make it a calculated risk with permanent consequences. This is the one that blindsides retirees who think they're doing everything right. IRMAA stands for Income-Related Monthly Adjustment Amount. If your modified adjusted gross income exceeds $109,000 as a single filer or $218,000 filing jointly, your Part B premium jumps, and it doesn't climb gradually. It jumps in cliffs. Cross the $109,000 threshold by even $1, and your Part B premium goes from $202.90 to $284.10 a month. At the top bracket, you're paying $689.90 a month, more than triple the standard premium. And here's the part nobody tells you about. IRMAA uses a 2-year look back. Your 2024 tax return determines your 2026 premiums. So if you had a one-time income event 2 years ago, sold a property, took a large Roth conversion, received a trust distribution, you could be hit with thousands in extra premiums right now. One Reddit user described exactly this. An unexpected trust distribution with significant capital gains pushed their adjusted gross income above the IRMAA threshold. Result: increased Part B and Part D premiums starting 2 years later, despite being retired and on a fixed income. To be fair, there is a remedy for one-time events. You can file Form SSA 44 to appeal the surcharge if you had a life-changing event, retirement, divorce, death of a spouse, or a one-time income spike. But you have to know this form exists, and most people don't. This is the mistake that truly cannot be taken back. When you first enroll in Medicare Part B, you get a one-time 6-month window to buy a Medigap supplemental insurance policy at standard rates. No medical underwriting, no health questions, guaranteed acceptance regardless of pre-existing conditions. Miss that window, and in 46 out of 50 states, Medigap insurers can deny your application, charge you dramatically more, or refuse to cover you entirely based on your health history. Only 4 states, Connecticut, Maine, Massachusetts, and New York, require guaranteed issue for Medigap year-round. In every other state, once that 6-month window closes, your health determines whether you can get coverage. KFF found that 69% of Medicare beneficiaries didn't even compare coverage options during open enrollment. 58% never visited Medicare.gov. 74% never called the 1-800-MEDICARE helpline. Most Americans don't know this window exists until it's already closed.
According to KFF, someone who has a Medicare Advantage plan, if their claim is denied 80% of the time, it's subsequently approved on appeal. This means that people go through a lot of frustration that those on a Medigap plan don't have to go through.
On Reddit, one user described a relative who missed their Medigap window and was told they'd be denied coverage based on pre-existing conditions. Their only option? Fall back to a Medicare Advantage plan, which comes with network restrictions and prior authorization requirements that original Medicare with Medigap doesn't have. Here's the truth. Nearly 780,000 Americans are paying a permanent Part B penalty, 2.5 million are paying a lifetime Part D penalty, and an unknown number are locked out of Medigap coverage they can never get back, all because of deadlines they didn't know existed and rules nobody explained clearly enough. If you're approaching 65 and still working, your 8-month special enrollment period clock starts the day your employment ends, not when your COBRA runs out. Mark it. If you're already on Medicare and haven't reviewed your plan during open enrollment, you're in the 69% flying blind. Visit Medicare.gov and compare before December 7th. If you had a large income event in the past 2 years and your premiums just spiked, SSA Form 44 may be your appeal, but you have to file it. And if you're helping a parent navigate enrollment for the first time, the 6-month Medigap window is the single most important deadline in this entire system. Miss it, and no amount of money can buy it back. I'll be covering the Medicare Advantage versus Original Medicare debate, the healthcare costs that destroy retirement savings, and the Social Security claiming strategies that could be worth $100,000. Subscribe to Why with Harlan so you don't miss the next breakdown. Thanks for watching. That's the Why. I'm Harlan. See you in the next one.